After this video, you'll know exactly what your knee MRI results or that of a friend or a family member actually means. So you get your knee MRI results back, and now you're staring at complicated words like tricompartmental osteoarthritis, mucoid degeneration, and grade 3 signal. And nobody took 4 minutes to explain to you what any of these mean. I'm going to try to fix that right now. I'm going to simplify 20 of the most common questions that people have about their knee MRI findings using simple, plain language, so you actually understand what's written on those reports. I'm Dr. Zikky. I'm a board-certified musculoskeletal radiologist. Let's start with meniscus. Your meniscus is a C-shaped cartilage cushion sitting in between your thigh bone and your shin bone. Their job is to act as shock absorbers, distributing the weight evenly across your knee joint. When something goes wrong here, it usually shows up on every knee MRI report. All right, let's start with tears. Complex versus a horizontal meniscus tear. A horizontal tear splits the meniscus into a top and a bottom half. Basically, it splits horizontally. It's common in older patients from gradual degeneration. A complex tear goes in multiple directions, so you can have a horizontal component, a vertical component, an oblique component, all within that meniscus. The shape matters because it determines whether the surgeon can repair it or whether to remove the damaged portion. What is maceration of the meniscus? It simply means that the meniscus tissue has broken down significantly. It's frayed, it's softened, and it's compressed. Think of it like a sponge that has been wrung out too many times. You see this in advanced degeneration of the knee, and it means that the cushion has lost its ability to do its job. What is discoid meniscus? Most people are born with a C-shaped meniscus. A discoid meniscus basically means it's a full disc of a meniscus. You were simply born with it shaped differently. The rounder and thicker shape is far more prone to tearing, even without significant trauma, which is why the symptoms often start in childhood. What does grade 1, 2, and 3 signal mean? This is the most misunderstood part of your knee report. Grade 1 and 2 are not tears. They represent internal changes within the meniscus tissue. The surface is still intact. Grade 3 means that the abnormality has reached the surface now. This is the only grade that represents a true tear. If your report says grade 1 or 2, those findings alone are rarely a reason for surgery. But grade 3 is. What is a meniscus root tear? The meniscus is anchored to the bone at its front and back ends. Now, those anchors are called the roots. A root tear means that it's basically torn at those attachments to the bone. Without it, the entire meniscus loses its ability to distribute the load across the knee joint evenly. Now, this dramatically accelerates the cartilage loss that leads to osteoarthritis potentially. This is not a wait-and-see finding. Get an orthopedic opinion promptly. Now, let's talk a little bit about some of the common ligaments in your knee. Why is my ACL sprained or completely torn? A sprain means that some of the fibers are disrupted, but the ligament itself is still in one piece. The stability remains. A complete rupture or complete tear means that the ligament is fully torn, and it would appear absent or wavy on the MRI. Most active patients with a full rupture or a full tear will need surgical reconstruction of their ACL to return back to those cutting and pivoting activities. Your lifestyle and overall knee health factor into the decision whether to do surgery or not. What is mucoid degeneration of the ACL? This is also very commonly mentioned on your knee MRI reports. And this one frightens a lot of people unnecessarily. Mucoid degeneration means that the ACL looks kind of thickened and bright on the MRI, but the fibers are still intact. It's not acutely torn. It's a gradual internal change from chronic stress. Many people with this finding have a stable knee and no functional limitations at all. Physical therapy is a very reasonable first step. What is MCL thickening? Well, the MCL stands for medial collateral ligament. It runs along the inner side of your knees. Thickening means that it has either been sprained or experienced chronic low-grade stress over time. The MCL heals exceptionally well on its own. The vast majority of MCL injuries don't require surgery. What is a Sagan fracture? Now, you might see this on your report if you have an acute injury. A Sagan fracture is a small fleck of bone on the outer side of your shin bone that looks almost insignificant on imaging, but it's caused by the same rotational force that also tears the ACL. So it's highly associated with an ACL injury. That's why it's significant. Think of it like a red flag telling the radiologist where exactly to look. Now, let's talk a little bit about the cartilage and bones. What is chondromalacia patella? Or chondromalacia for short. Translated directly, this is the soft cartilage behind your kneecap. So chondromalacia is the wear and tear on the cartilage surface of the kneecap or the patella, and it's one of the most common causes of front knee pain. It gets worse going down the stairs or going up the stairs or sitting for long periods. Early stages respond very well to physical therapy, focused on how the kneecap tracks in its groove. What does full thickness cartilage loss mean? It means that cartilage in a specific area has worn out completely. Basically, the cushion of the bone has worn out, and then the bone is now contacting the bone in that spot. This is what people mean when they talk about bone-on-bone contact. But full thickness loss in one small area is very different from the entire joint. You can have one small area from things like trauma without affecting the entire joint itself. Location, size, and how your symptoms match that location all matter before any treatment decision is made. What is subchondral bone bruise? Subchondral bone bruise is a bruise inside of the bone just beneath the cartilage surface. So basically, subchondral means right below the cartilage. It's invisible on X-ray, but clearly visible on MRI. This happened from significant impact and compression. They are painful and take time to heal, weeks to months. Returning to high impact activity too soon can slow down the healing and damage the cartilage above it. Rest is not optional in these cases. What are loose bodies in the knee? Now, you might see this on your MRI report, and it simply means that small fragments of bone and cartilage have broken off and they're now floating freely in the joint fluid. When they drift between moving surfaces in the joint, they can cause that sharp pain and that sudden locking and catching sensation that people usually describe. Symptomatic loose bodies, basically those ones that cause pain, catching sensation, and locking, they may need to be removed, typically through minimally invasive procedures with cameras. What is Osgood-Schlatter? Now, for parents and young athletes watching this is a condition. It's not a disease. In growing teenagers, right, the patella tendon pulls on the growth plates right on top of the shin bone during rapid growth spurts, and it creates this painful bump just below the kneecap. The good news is that it resolves on its own in the vast majority of cases once the growth plate closes, but you might still have a bump there for the rest of your life, basically. Activity modification, basically stopping those things that aggravate it, and physical therapy gets kids through this one. Let's talk a little bit about some fluid and lumps in the knee joint that you might see on your report. What is a Baker's cyst? A Baker's cyst is not a tumor. A Baker's cyst is a pouch of excessive joint fluid that has pushed through a weak spot in the back knee joint capsule. The critical thing to understand is that the cyst is a symptom, not the problem. Something inside the knee, arthritis, a tear, inflammation, is producing that excessive fluid. So treat the source and the cyst typically resolves on its own. What is joint effusion and synovitis? Effusion simply means excessive joint fluid. Now, your joint has a little bit of fluid to keep the parts moving, basically to lubricate the parts. But when this fluid is excessive, that's called the joint effusion. Synovitis is inflammation of the joint lining. These are your body's responses to something happening inside the knee joint. They're not the diagnosis themselves. So our job is to identify what's driving the inflammation, not just manage the swelling. What is Hoffer's fat pad or Hoffer's fat pad impingement? Behind your kneecap, there's a fatty cushion that sits back there and is supposed to protect the joint. Now, when it gets chronically pinched between the kneecap and the thigh bone, it becomes inflamed and painful. You will have sharp pain right below the kneecap that worsens when you fully straighten your legs. It's frequently overlooked because it's less well known than meniscal injuries, ACL injuries, but it responds very well to targeted physical therapy. Let's talk a little bit about some scary terms that you might see on that MRI report of your knee. What does tricompartmental or tricompartment osteoarthritis mean? Your knee has 3 compartments, the inner half, the outer half, and where the kneecap meets the thigh bone. Tricompartment arthritis or degenerative changes basically means that these degenerative changes are present in all 3 of those areas. This is the finding that is most associated with eventual knee replacement considerations. Now, the key word here is eventual. Many patients manage well for years with physical therapy, weight management, and appropriate injections. The scan shows the anatomy. Your symptoms and quality of life drive the decision of whether or not surgery is required. What is patella tracking or patella malalignment? Your kneecap should ride smoothly up and down in this groove as your knee moves, basically like a train on a track. Malalignment means that it's drifting away from that track, usually to the outside, and this causes uneven pressure on the cartilage behind it. This is usually driven by muscle imbalances, so weakness in the inner quadricep muscles, tightness on the outer quadricep muscles are common causes of this. Physical therapy actually corrects the underlying mechanics here, not just the pain that is associated. And finally, why does your report say clinical correlation recommended? Because as a radiologist, I see the images, but I don't examine you. We don't know exactly where it hurts, how you walk, or your full history. So when we write clinical correlation is recommended, we're telling the doctor who ordered the examination that the scan shows this. Please confirm that it actually matches what the patient is experiencing. It's not a hedge. It's a reminder that the image is one piece of the information, not the whole story. Your knee MRI is an honest picture of what's been happening inside of your knee joint, sometimes over years. It captures history. It doesn't determine your future. Some of the scariest sounding findings respond beautifully well to physical therapy and time. The difference is how those findings we see in an MRI connect to your actual symptoms, your lifestyle, and your goals. You deserve a physician who takes time to make that connection with you. And now you have the language to demand that conversation. Please drop a comment if you want anything that I said further clarified, or if you have some other confusing words on your MRI report that was not covered in this video. And don't forget to subscribe, because we're going to be talking about other joints. We're going to talk about your shoulder, elbow, ankle, spine, x-rays, CTs, MRIs, and lots more. See you in the next video.